Hi, everyone. Welcome to the very first video for our new project called Decipher Your Health. My name is Marijke Vroomen Durning, and I'm coming to you from bitterly cold Montreal, where we're supposed to be breaking records today. And I am here with my partner that I'm trying not to be too jealous of, and her name is Karin.
Hi, I'm Karin Molander. I'm an emergency medicine physician, and I'm in not sunny at the moment, California. We just had some rain, so we've had some record rain in the past few months, but I can't complain. It's not 40 degrees below zero, Marijke.
Yeah, it's a little nippy out there. Yeah. We wanted to tell you a little bit about our project before we start our regular videos. And Decipher Your Health is a really important project to both Karin and myself, because through our careers, myself as a registered nurse and Karin as an emergency medicine physician, we've come across patients who really didn't know what was going on. They didn't know what kinds of questions to ask and things like that. So we thought it would be a really good idea to make videos and to write blog posts to try and help people understand what they should be doing to help them be part of their own healthcare team. So I'm going to let Karin take over because she describes it really well.
I think one of the challenges that we face right now, Marijke, and my friends out there, is that there has been a huge gap that has developed between the patient and the nurse relationship and the patient and the physician relationship. And that's the EHR and a whole lot of other things. I think that there are definitely some benefits to the electronic health record, or EHR as we'll use as one of our terms here. However, I feel like we need to get back to basics. And the hashtag that I'm using these days is hashtag back to the bedside. And we want to help the physician put the patient first. You know, the person who is most important in this relationship, who is most motivated for good health, is the patient, one would hope. And we want to help empower you, the patient, so that your experience with the healthcare system can go a little more smoothly than maybe it has been lately.
Yeah, and that's really the point. I mean, things are very bumpy right now, but also medicine has really changed a lot, right, Karin? I mean, from what we're doing now to when we both started in our careers.
Okay, yeah, I don't know about you, Marijke. Are we ready to admit how long we've been doing this?
Yeah.
I've been doing medicine since the 1990s, and it has been quite a change from when I could write a quick note when someone came in with a hip fracture that was about 20 letters long, and be able to communicate quite effectively with the orthopedist. And be able to spend a little bit more time at the bedside explaining to the patient and the family what they might expect. And nothing like a pandemic to throw a whole, bump into the process. But losing the patient advocate at the bedside during the past 2 years made me realize that we need this project now more than ever.
Yeah, I agree. I started in the 80s. And, we were then, we weren't even wearing gloves when we were taking care of our patients most of the time, because that was just as AIDS was starting. So we were doing, back rubs, touching our patients, talking to our patients, doing all that sort of thing with them. But then AIDS came, and then we had to start with universal precautions. So now we had to wear gloves every time we touched a patient. Everything just changed, all of a sudden nurses were getting, I mean, it's great. They were getting more educated, they were getting degrees, but then they didn't really want to give patient care anymore. So they started doing more management. So then other nurses, like the licensed practical nurses or vocational nurses, took over, and the RNs ended up only really assessing patients, like going into the room. If somebody said, Mrs. So-and-so has a red spot on her backside, can you come and look at it? When before, we used to be the one bathing the patient, and then we would see the spot. Oh, okay, I have to make note of it and I have to go do it. So it's like there's almost this new layer of things that has to be done.
I would add that there's even more layers than that. You know, we have medical assistants now, we have physician assistants now, we have LVNs, we have RNs, we have ED techs that could be an EMT, so lots of letters out there. Sorry for all you folks out there. We'll give a description of what each of those are. But in a nutshell, it means that there's a larger team involved in the care of the patient. And
Mhm.
oftentimes a patient is reeling, they just want an answer. I was reading an article earlier today where 2,000 folks were polled and admitted that 1 out of 5 went to TikTok for their medical advice.
Mhm. Yeah.
You know, I think the statistic was 67% sought out Google for
Yeah.
medical advice before their medical care provider. And we have to recognize that this is going to happen as a provider.
Mhm.
I can remember years ago when this was coming out, at first, the level of insult that physicians would feel. We even have mugs made saying, you know, Google does not equal a medical degree or whatever the
Mhm.
case may be. And I think that providers are going to have to say, it's okay for patients to be concerned and look up their symptoms as long as they're using a reputable source. We
Right.
have to recognize that we want them to come in armed with questions and concerns. The key is trying to get back into an effective loop in communication.
And we're going to discuss that in one of our videos and blog posts. What sites are the better ones to go to, how you can evaluate if it's a good site to go to, because at first glance it might be good, but if you dig a little deeper, it's not. And I've written articles about that. People, there's always going to be people out there that want to sell you something. So
Exactly.
you need to know what you're looking for. So those are all things we're going to be talking about. And the one thing that I really wanted to point out too is we have a disclaimer. We are not offering medical advice. We are not offering treatment options. We're not diagnosing or anything like that.
Our goal at Decipher Your Health is to educate. However, we do not have a personal relationship with each one of you viewers here. You are free to share our information with your primary care provider before changing any of your medications, any of your health routines. Please consult with your primary care provider.
That's right. And for more details on the disclaimer, you can go to the About section of the YouTube channel and you can read more about it. Okay, so that's it for this session, and we will see you with our next video. Bye for now.